Hello, welcome back. So nice to see some familiar faces. Thank you all for tuning in and watching these videos. I hope you are finding them helpful. If you're new, I am Dr. Brittany Panico. I'm a rheumatologist in the Phoenix, Arizona area. And I'm here really just to try to provide some information that is tried and true and trusted source for patients with autoimmune conditions. I know there is so much information out there available to us on Google, on WebMD, on really any health platform. And I just want to be a source of advocacy as well and really try to promote to patients with rheumatologic or autoimmune conditions that we want you to be a part of your decision making. We really want you to be a part of your treatment plan. And coming to your visits feeling prepared and asking questions is really what I want to promote. And part of that is understanding what your diagnosis is and understanding what it is that you're coming to the rheumatologist for. And in the beginning, that might be really confusing and difficult to determine, especially as we're running tests and trying to figure out what your diagnosis is. But ultimately, once you've gone to a couple visits and we start using language and prescribing medication, it's really important for you as a patient to understand what you're taking your medication for and why you're on the dose that you're on and what are some potential side effects and risks of those medications. And understanding what it is that we're talking about when we check in with you every few months. Because oftentimes as rheumatologists, we see you more frequently than a lot of your other doctors. And we really want to try to build that relationship and get to know our patients. And one of the things that I really like to sit down and talk to my patients is about what you want, what your goals are as a person, right? Do you have rheumatoid arthritis and you're really struggling to play with your kids, or you're struggling to do certain activities, or you're struggling to work and type? Whatever it is, we want to meet you where you are and figure out ways to help get you feeling better. And really that's what I'm here to try to promote and share the message about, is shared decision-making and patient advocacy and just showing up and getting the most out of your office visits, because we know that, taking time out of your day to come to the doctor can be frustrating, but it can also be encouraging to know that you're making progress, to know that you're doing really well with your treatment plan. So I just really encourage you to take some time, and maybe the next time you show up to an appointment, share some goals that you have. Talk to your doctor or healthcare provider about what you want out of your treatment plan. And if you're somebody who's on medication and feels that you're doing really well, talk about when we can decide to start scaling back. When is it okay to start decreasing the dose of your medication? When is it okay to take away medication, for example? And if you're somebody who's on prednisone maybe and have been on it for a while, talk about at what point you might be able to try to wean off, because a lot of times our goals these days are to have patients on less prednisone. You can watch one of my other videos that I did earlier where I talked a little bit about prednisone. And maybe you're somebody who just is tired of taking pills and is wanting to try something different to treat your condition. Talk to your doctor about other ways that you can accomplish your goals, maybe with less medication or fewer pills. If you're somebody who's on an injectable or biologic medication, maybe there's a time that you can start spreading out your doses and seeing if you can go a little bit longer. The other side of things is to have the conversation when you're not doing well. So we really want to hear from our patients who are struggling, because there are so many treatment options out there now that we don't have to stick to just one or two. We have so many things that we can offer that if you're struggling and aren't meeting the goals that you want for yourself, you have to let us know so that we can talk to you about alternatives. If you are on an injectable medication and just decide this is not really fitting with my lifestyle goals right now and want to switch to a pill option if that's available, or even an IV infusion where you go into an infusion center, maybe associated with your doctor's office, and get your medication that way. There are so many options available, and a lot of times it just starts by asking the question, what else is there for me? What else can I take for this condition that I have? And along those lines, if you're having undesirable side effects, then we want to know about that. There's the obvious hives or allergic reaction, but then there's the less obvious things like feeling kind of queasy to your stomach, or just not feeling like you're yourself on your medication, or feeling like you have depression or anxiety related to the medication that you're taking, or you just aren't sure why exactly you're on the dose that you're on. Those are things that we want to be able to talk about as well. And they only come up if you ask questions related to how you're feeling. Oftentimes, medication that people are taking can be associated with an app. For example, if you're on one of the injectable biologics, the drug companies make apps, phone apps, that you can use that track your symptoms. There's lots of other free or very inexpensive ways to track your symptoms and the symptoms that you have associated with when you take your medication. Even if you just use your plain calendar app on your phone, that's a great way to log your symptoms and come to your next doctor's appointment with those things ready to talk about and saying, I notice on the days after I take my medication, I feel like this. Or I notice that my injection just doesn't feel like it's lasting the whole time until I'm due for my next one. And these things can really prompt us to adjust your dose or manipulate the timing of how you take your medication. There's so many ways that we can adjust things that we want to know if you're not feeling well with the prescription plan that we have set in place. So I'm really excited to see people joining and the followers that we're building here, and spread the word. If you know somebody with an autoimmune condition or a rheumatologic diagnosis or osteoporosis or gout, have them follow me, because I am here every week talking about different topics in rheumatology and ways that we can help spread the word for rheumatologic conditions and diagnoses, and really just encourage patients to speak up and get the treatment that they want so that they can live the life that ultimately that you want as a patient. So thank you for joining me. Invite your friends, tell your family, your coworkers that I'm here, and hope to see more faces, and feel free to comment below. Thank you. I'll see you next time.